Good afternoon and welcome to the Mekong Hepatitis Symposium 2020. In the context of the COVID-19 pandemics, this year the conference is a digital conference and we are very pleased to be with you in this context. We are today at L'Épensière, the conference center of Fondation Mérieux, to record the opening of the conference that will be present to you in Southeast Asia. I welcome Professor Christian Trépeau for the key remarks.
I'm very pleased to address to you to open this Mekong Symposium 2020. And indeed, this is an opportunity to speak to you from the Pensière Meeting Center, which was recently renovated. One word about this center, which used to be a family house and turned by Charles Mérieux into a Congress Center welcoming famous conventions all over the year. In the pure tradition of the Mérieux family, Christophe Mérieux, the grandson of Charles Mérieux, spent his military time in public health in Asia and got inspired especially by what he saw in Laos. This is why later on he founded a new entity, the Infectiology Center Laos Mérieux, which started to develop tests for HIV and hepatitis, especially viral load, for the whole country. In this context, in 2012, we started the first course on hepatitis. This was initially in French and local, then progressively became regional and in English, and finally international, as you can see on the picture from the last event. This was made possible because new sponsors joined, especially Gilead and recently FIND. As Nicolas told you, the format this year was decided to be digital, but not only digital. We had envisioned the possibility that each of these records will be displayed in 3 towns of Southeast Asia, Laos, Cambodia, and Thailand, and that will make it possible to discuss and interact and keep the spirit of the Mekong Symposium, which is now an entity putting together fast progressing countries and will make many progress and deserve fully its nickname of Mekong Hepatitis Symposium. The program this year will be addressing 4 topics: HBV and especially maternal transmission, HCV elimination strategies, HCC, which is the #1 killer, and least but not last, the COVID. Thank you for your attention.
After the key remarks of Professor Christian Trépeau, I would like to introduce you to the scientific committee of the Mekong Hepatitis Symposium 2020. Of course, chaired by Professor Christian Trépeau, but also with Dr. Paul Denis, Gonzague Jourdain, Wutinchin Kemduang, Phimpa Paboriboon, and Mardi Sak. Paul, would you like to join us for your welcome remarks?
So, thank you, Nicolas. So, dear all, well, it's a great honor to be invited for this special session of the 2020 Mekong Hepatitis Symposium. Now, you know, we are entering a decade which a main goal is to obtain the global elimination of viral hepatitis that should be underway in 2030. Mostly, this will concern hepatitis B and hepatitis C, which may represent more than 90% of chronic viral hepatitis. Our vaccination against hepatitis B virus is very efficient, and vaccinal policy should be heavily sustained to decrease HBS carrier prevalence and prevent chronic liver damage, liver cirrhosis, and cancer. Furthermore, with this vaccination, you will eradicate the hepatitis delta virus superinfection, so it will be get one vaccination for two viruses. And for chronically infected HPV patients, new therapeutic schedules will complete antipolymerase therapy for an HPV cure. For hepatitis C virus, no vaccine. But the good news is that the viral genome is an RNA molecule that does not integrate into the infected cell. And the viral infection persists due to the expression of the viral polyprotein, to the maturation of the protein by the viral polymerase, and to the viral replication. So if you block the viral replication and if you block the viral protease, you will eradicate the infections. And the therapy exists. So in 8 to 12 weeks, and in an ideal world, everybody would have access to the treatment. Therefore, it's very important to know if a patient is infected. Here is a major simple problem, because no more than 10% of patients know that they have been infected or are under treatment. So, as a result of the COVID-19 pandemic, it has also been observed that many fewer people who are at high risk of hepatitis will be tested this year. So what can we do? Well, we should keep the information at the high levels, and that it seems important for the organizer and the scientific committee of the Mekong Hepatitis Symposium to keep on this year with a virtual meeting. Hepatitis prevention, hepatitis testing, and treatment service would be decentralized, and every opportunity should be seized to identify the 290 million of people that are viral hepatitis but that are unaware of their status. For example, in the Lao PDR, we suspect a prevalence of 5% of patients. Approximately 300,000 people might be screened as infected. Screening is therefore one of the most vital steps to achieve the cure for the patient and the viral contamination to decrease. As for the COVID-19 anthem, you know it, test, test, test. Well, test with simple tool may clearly be of great interest to get the information on the infection in patient. We shall describe the new point of care tools that may be helpful, and we will also integrate a COVID-19 section to keep information at up-to-date level. I hope you will enjoy your participation to this meeting, and that we keep in touch by interacting more directly to get benefit of your experience in the future. Thank you for attention.
Thank you, Paul, for your welcome remarks. Now we give the floor to Benoît Chevalier.
Good afternoon, everyone. I am Dr. Benoît, country representative of Merieux Foundation in Laos. I am happy to welcome you in this annual Mekong Hepatitis. It's important for all of us to meet every year to discuss this topic because despite vaccine and many medical treatments, infectious diseases do not disappear. Some of the most well-known infectious diseases include malaria, tuberculosis, dengue, HIV, and viral hepatitis. But viral hepatitis kills as much as tuberculosis in the world, but is more than malaria, dengue fever, and HIV combined. In Laos, the prevalence of hepatitis B is around 9%, especially mother-fetal transmission. While infectious diseases are diverse, we know that their course is also diverse when the disease goes undiagnosed. Left to itself, that means untreated, it can, if it's acute, quickly kill the patient or cure him. But between death and complete health, there are chronic illnesses which do not recover, continue, change, and give rise to other illnesses as cirrhosis or cancer. I would like to thank the speakers for the quality of their presentations, as well as all the participants for their contribution and interest. Thank you very much.
Thank you, Benoît, for your remarks. And I would like to welcome on the floor Gonzague Jourdain for your opening remarks to this Mekong Hepatitis Symposium 2020.
Dear participants, I am happy that you were able to come to this meeting today to make more real this virtual Mekong Hepatitis Symposium. This shows our shared commitment to fight viral hepatitis in this region and our commitment to win this fight. I'm Gonzague Jourdain, a clinical epidemiologist. My main activity is to conduct clinical trials to improve our methods to fight infectious diseases. But I am especially interested in the strategy that could definitely eliminate perinatal transmission of hepatitis B. I work in Thailand and in Laos for the French National Research Institute for Sustainable Development. As a representative of this institution today, I have to say how important the Sustainable Development Goals are important to me and my colleagues. We may have been distracted by the COVID-19 pandemic this year, but it's important that we don't forget the fundamentals. COVID-19 will not solve the problem of viral hepatitis anywhere, and in this region, viral hepatitis remains a much bigger problem because viral hepatitis continues to prevent a huge number of people to live a happy and healthy life, and sometimes kill them. So let's not forget, in 2030, as Paul just reminded us, the burden of hepatitis must be reduced considerably. Why? Because it's a big killer, but also because fighting viral hepatitis can contribute to reach other SDGs, Sustainable Development Goals. For example, SDG Target 1.1 is to eradicate extreme poverty. People with viral hepatitis need to have access to efficient and quality treatment at affordable prices. They should not have to spend huge sums of money and become poor just because they are sick. Target 3.1 is about maternal mortality. One of the causes of maternal death is hepatitis E in this region. We need to find ways to better prevent this infection and its consequences. Target 3.4 is about premature mortality due to non-communicable diseases. Liver cancer is the worst outcome of viral hepatitis B and C. We should get rid of this problem and people should no longer die because of viral hepatitis. A large part of this online symposium will be about these two infections. I could continue this list, but I have no time. So this is my main message today. This symposium will contribute to improve our knowledge and our practice, and this will help improve the health of the people we are serving. I wish you an excellent meeting today and hope to see you again, maybe next year. Thank you.
Thanks a lot, Gonzague, for your welcome messages. And now I would like to invite Wuti Chan Kamduhong for your welcome remarks. Wuti Chan.
Okay. Thank you for your introductions. Dear all participants, I am Wutichai Kamduong. I'm a virologist at the Faculty of Associated Medical Science, Chiang Mai University, Thailand. And first of all, I would like to give a warm welcome to all of you to participate in our symposium this year. For myself, my research interest is focusing on the molecular virologies. During the past 20 years, I involved in several studies focusing on prevention of mother-to-child transmissions of HIV and also the co-infections, including hepatitis B, hepatitis C, and also cytomegalovirus and other viruses. Recently, I am involved in conducting the clinical trials on prevention of hepatitis B from mother to child, names ITAP with PHPG teams, and also the NAPPING project, a study for provide counseling service for sexually transmitted disease in Thailand. During the COVID crisis, we also provide a diagnosis test for the people who could not access to the molecular laboratory testing in Chiang Mai and also in the northern part of Thailand. For me, myself, I am very happy to be a part of the scientific committee to help and contributing these important meetings, the Mekong Hepatitis Symposium. And thank you so much.
Thanks a lot, Wuti Chan, for your welcome remarks. I would like now to invite Pimpa Paboribun for her welcome remarks. Pimpa?
Sabadi, good afternoon, everyone. Welcome to Mekong Hepatitis Symposium. So, as you know that this symposium we create since 2010 with Professor Pondini and Professor Tripo. So this year is 10 years that we create this symposium. This symposium start at national level. So we invite all clinicians who are working in the hospital in the country to participate in this symposium. After that, we become bigger and bigger. Now we are at international level, and it's a chance for this year that we cannot invite all speakers from France, like Professor Tripo and Professor Pondini, to join with us. So the Lao doctor will miss them a lot. And thanks to this symposium, Laos can create or we build a national guideline on hepatitis B and C treatment. So during this symposium for this year, we will announce that this guideline is already and translated in Lao language and very useful for Lao doctor that they will use in their hospital, in all hospital in the country. So I hope that this year that the information that we will present during symposium will help everyone to understand and to follow their patient better and better. So I wish to all of you to have a big success to this symposium, and also thank for your contribution to this symposium. So see you again, and we will see on during symposium. Thank you.
Thanks a lot, Pimpa, for your welcome remarks. Lastly, I would like to introduce you to Mardi Sek, that is in Cambodia, and we are inviting Mardi Sek to the floor for your welcome remarks. Mardi?
Yes, thank you, Nicholas. Good afternoon, ladies and gentlemen. My name is Mardi. I am county representative of Phong Chong Mayor in Cambodia, and I'm also the member of the viral hepatitis technical working group of the Ministry of Health in Cambodia. It is my pleasure to welcome you all in this annual Mekong Hepatitis Symposium 2020 and to express my sincere appreciation to Mayor Foundation and the organizers for taking the leadership to organize this meeting to put viral hepatitis high on the health agenda. Cambodia has come a long way in addressing viral hepatitis epidemic. It had more case burden, 10 times to HIV, 24 times to TB, and annual death 3 times to HIV and comparable to TB. While HIV and TB program are receiving government funding and from donors, viral hepatitis program has not yet got much attention. Even though the hepatitis B vaccination program has achieved good impact, treatment for HBV and HCV is not widely available or accessible. It is limited to most of national hospital and private hospital. The Mayor Foundation is committed to work with Cambodia Ministry of Health and key implementing partners to address the challenges related to viral hepatitis in the country toward the vision free of new hepatitis infections in Cambodia, where people living with chronic viral hepatitis infection have access to effective and affordable diagnostic, care, and treatment services of good quality. I am fully confident that this meeting will give us the opportunity to build a framework for the future development and strengthening local capacities to fight the viral hepatitis. I would like to encourage participants to actively engage and provide their input into this meeting. I wish all you fruitful deliberations and a successful outcome of the meeting to start our journey together towards the elimination of viral hepatitis in developing countries, particularly in Cambodia. Thank you for your attention.
Thanks a lot, Mardi, and thanks again to all the scientific committee of the Mekong Hepatitis Symposium 2020. It is an unusual format. Again, it's a digital conference, but we are very pleased to be with you even in this context of COVID-19 pandemics. I would like now to invite to the floor our friends from FIND that kindly support this conference. Sonja?
Thank you, Nicholas. And thank you to all of the organizers and the scientific committee. We're very pleased to be with you this year. Last year was the first time I had the chance to attend one of the Mekong symposiums, and it was a very great experience for me. I think we learned a lot, and being able to discuss with all of you in the region your questions and concerns around diagnostics specifically really helped us to expand where we need to work on next. So I'm Sanyal Scholten. I'm the Deputy Head of Access for FIND, the Foundation for Innovative New Diagnostics. And I think that everyone so succinctly and well said many of the key issues already that I don't have to repeat, but I would just like to highlight on some very important points, which is 2030 is where we hope to eliminate viral hepatitis as per the WHO goals. So that's 10 years away, and we have quite a bit of work to do. We need to find over 50 million people living with hepatitis C and over 200 million people living with hepatitis B. Now, we have some challenges. Obviously, COVID has really disrupted a lot of our service delivery for many other routine programs, including viral hepatitis. But there also are some opportunities. So COVID has shown us that we can do integrated testing, on platforms that exist for other diseases. They were able to bring in the COVID test and quickly roll that out. So could this be an opportunity for us to later on use these same integrated platforms for hepatitis C and B? We have a lot of good momentum now coming out with the PMTCT guidelines for hepatitis B and some new simplified algorithms for that. So how can we capitalize on that momentum and on the triple elimination momentum to build further action and interest in tackling hepatitis? So what we hope to do is come together and work to simplify hepatitis service delivery in a decentralized manner, integrated into other care pathways. And I think if we all come together and problem solve, we can make really great progress. So thank you once again to the organizers and to the scientific committee, and thank you very much to the participants for taking time for the conference.
Thanks a lot, Sanjel, for being here with us today. We are in Les Pensières in Annecy, that is very close to Geneva, and we are very pleased to have you here today on this digital opening of the Mekong Hepatitis Symposium 2020. Now the symposium is open, and I wish you all participants a good conference.